Point 4 will be presentation of proclamation designating May 2022 as Maternal Mental Health Awareness Month in Lake County. And Supervisor Sabatier will read this proclamation.
Anybody want to come up with me for this proclamation? Oh, hello?
Yeah, if anyone's here for this proclamation, please come forward.
Maybe you should have just went down there.
I felt alone. I knew I wasn't supposed to.
I think they need to join us up here further. Up here.
Yeah,
Come on up, please.
Good morning, good morning.
Keep coming up. I'm up here. That's not really up, but I think we're full.
We're full. Good
All right.
stuff.
So I'll go ahead and say the proclamation. Designated the month of May 2022 as Maternal Mental Health Awareness Month in Lake County. Whereas maternal mental health is an issue of great concern to Lake County's parents, families, and healthcare providers. And whereas these disorders can affect any mother, regardless of age, race, or income level. And whereas many women are not adequately informed about, screened, or treated for pregnancy and postpartum mood and anxiety disorders. And whereas heightened awareness and stigma reduction are essential for improving outcomes for mothers, children, families, and communities. And whereas pregnancy and postpartum mood and anxiety disorders are highly treatable through therapeutic intervention, community-based supportive services, and medication. And whereas health service providers and community support systems must be able to identify risk factors and symptoms in order to provide prompt diagnosis, treatment, and support services that enable full and speedy recovery. And whereas Motherwise is a proactive program that helps mothers and families through the transition with a new baby to prevent and lessen the effects of perinatal mood and anxiety disorders. Funded through Lake County Behavioral Health by Proposition 63, the Mental Health Services Act, Motherwise provides the support and services necessary to meet our mission of helping new moms understand that if they feel depressed, they are not alone, and effective resources are available to support them. For over 12 years, Motherwise has provided this essential support free of charge to thousands of mothers and families in Lake County. Last year, Motherwise became a nonprofit organization, strengthening our dedication and commitment to moms in Lake County. Motherwise conducts maternal mental health screenings, offers peer support and mothers groups, hosts an online village community, and operates a closet of maternity and baby items given to local families. These services, which help new moms create a network of support close to home, reach over 1,000 Lake County mothers and families annually. Motherwise supports all of the grandmothers, daughters, aunties, sisters, and mothers of Lake County coming together in support of Maternal Mental Health Month. Maternal mental health now leads to stronger families and communities tomorrow. Now, therefore, be it proclaimed that the Board of Supervisors of the County of Lake does hereby designate the month of May 2022 as Maternal Mental Health Awareness Month and does commend this observance to all citizens, passed today on this third day of May 2022. So I want to say, if this is not personal to every single one of us, if we are alive, we had a mother. If we have children, we might have a daughter. We might even have a spouse. At this point, that has impact on them at one point or another. Having an experience of having a child is one thing, but imagine being a new mother and not understanding exactly what your body is going through, what you're going through. This is not something that I will ever understand on a physiological level, but something that I fully support, that if we take care of our mothers, we are also taking care of our children. So thank you for bringing this proclamation to us today, and thank you for all the work that you do. I have been connected with MotherWise since Jacqueline Lee started it a long time ago, and absolutely have supported her efforts and continued efforts with the new leadership over at MotherWise. So again, thank you so much. Is there a person that would like to speak?
Thank you. Well, and as you mentioned, you're never going to experience this, but we do know that dads, grandparents, and foster parents as well are susceptible to depression with a new baby in the family. And half the time when a mom is depressed, the dad is too. So this is something that guys go through as well. I'd like to thank you for recognizing the month for Maternal Mental Health Awareness Month. I'd also like to thank my staff that is here. We have our concierge, our bilingual concierge, Veronica Pantaleon. I have my social media person, our brand ambassador, Carolyn Bohr, and our newest staff member, Leah Miranda, who is my assistant, as well as Jacqueline Lay, who you mentioned. She is just supporting us in her new role. And then I'd also like to thank our board member, Yvonne Landwehr, who's here, and our board in general for supporting the program. And other than that, I'd just like to say we're really excited to have a very full team to really meet the need in the community and help as many moms as we can. And we have a lot of exciting things coming up, groups, walking groups, things like that. So it's really nice to get back to those in-person services. Thank you so much.
Here you are.
Thank you. I would like to say.
Oh, you want us all?
Hold on, we're not done.
Sorry. So I'm Jacqueline Lay, as Bruno mentioned, and I used to run the MotherWise program. Last year, my mom died suddenly, not from COVID, but it was a long, drawn-out process, and I had to step down. I just was not able to cope with that and run a program. So Liz, who was my main employee at the time, my cliches are going to get mixed up, but she stood up and she took the reins and was able to keep delivering our services to moms seamlessly. And that was not easy when I really just had to leave. So I just want to thank Liz, and she deserves a huge round of applause for keeping us alive. Thank you.
Thank you.
It's because of proclamations like this that we need to figure out how to rearrange our...
Rearrange everybody.
I think we have you have a comment? Tina, go ahead.
Just a comment on this. I think we've known for many years that it takes a village to raise a child, and we are so fortunate here in Lake County that we have our village, and that everybody comes together to help mothers. And it's not just new mothers. It's mothers with children of all ages that need assistance. So thank you, Lake County, for being there for our families.
Jessica?
So I agree with that. And I so thank you for all of your work and building this network in this village. It is really difficult to be a new mom sometimes. I had a really hard time myself, and just destigmatizing that is so important for all of us to achieve that health that we need together. And the walking groups and the mommy groups, all of those things are so important to prop each other up and have those moments when you need to laugh or cry or whatever it is. So I'm so grateful that we have this network, and just grateful for all of the work that you all do. Thank you so much.
Thank you. Is there anyone from the public that would like to comment on this? Scott?
Hello, my board. My name is Scott Abbott. I'm the program manager at Behavioral Health Services here in Lake County, and I'm over the Mental Health Services Act and housing. And we do a big part in help funding Motherwise, and we're very honored that we're able to have that opportunity. Recognizing this is a very important service that's provided within our community. As a father of a beautiful daughter who had a beautiful son last November and who's had to deal with resulting issues, I'm really grateful that there's organizations such as Motherwise that can help with that. Thank you.
Thank you, Scott. And I'll just have to say myself, I wanted to say it earlier, but I don't know if I would have kept my composure, but my mother had me at the age of 16, and the only person she had during that time frame was a grandmother, but a lot of young women don't have anybody, so programs like this give them a sense of security because they don't know what they're going through. They haven't been through it before, and if they don't have someone there that they can share this information with or share this time or experience, then sometimes they're just lost, and then that can sink further into depression. So again, thank you. All right. With that, the silent clap, thank you.